Sometimes if I would feel a bit depressed, I would start punching up a wall. Instead of cutting my wrist, I would do that rather, you know.
I got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
I was obviously clinically depressed, like, you know, this isn't just low times, we're talking, yeah, pretty bad.
And when you faint, do you actually sort of lose consciousness, or do you just go to the floor?
When I fainted, I knew what was going on because one of my friends said you're going yellow, so I got to the floor and then I fainted. Good morning, Putney Mead. Naomi speaking.
Yeah, just to let you know, it's a teaching appointment, so there's going to be a student in the room.
At the moment, there's nothing I can book in advance.
So what's your date of birth? And what's the name?
Hans, morning. Right, so what's happened in the last 10 days?
Well, I can tell you what's happened this morning. Very depressing for me. I ran upstairs to the toilet, but I had
An accident?
Yeah, an accident.
Loose or?
Yes, it's always very soft. I don't have any constipation. What I have noticed on the pan is the stuff was going not down, but up and sideways.
Right.
And it was on my cheeks too.
A bit of splatter.
Yeah, I've never had that before. March this year, I had an accident in the kitchen where, you know, luckily it was on the lino, but, you know, it's pretty disgusting, isn't it?
Right, okay, so you had all those blood tests done and kidney function's normal, thyroid's normal, liver is completely normal, kidneys again are normal. Okay, we're going to have to feel the back passage, I'm afraid, Hans.
I feel sorry for you. Would you want me to take trousers and pants?
Oh, just pull them down. You don't need to take them off.
Yeah. I do get some on the side of the pants, some hard, dark, blacky brown spots, and they're very hard to shift. I have to get a scouring pad. I can't flush them away.
Right,
They're very sticky.
Roll onto your left side.
Left side, sorry.
That's okay.
There we are.
You get a bit of itching down here, don't you? The skin's at the back is just a little bit abraded.
Well, I suppose that's because I've been rubbing it, especially this morning.
Okay, little pressure, shouldn't hurt.
Yeah. Oh.
There's certainly no blood there.
Good.
And no lumps.
No lumps. So it's not piles or hemorrhoids.
I certainly couldn't see any, and
there's no mess in the passage at all?
No.
Oh. It's funny, since you've done your examination, I feel I got an urge to go to the toilet again.
It's not uncommon. You may have to go, yeah. But it's not been diarrheal.
It comes out stringy, like about the size of my index fingers, curling round, you know. And then I've had soreness.
Is it itchy at the moment?
No.
No. I don't have any strong alarm bells about any of this at the moment. I think we're going to wait and see for 3 months, Hans.
Right, thank you.
I haven't got any magic medicine at the moment.
If there are any more problems, I'll come back. Thank you, Doctor.
Okay.
I woke up like this morning. Yeah, I have very bad teeth. I'm ashamed to say. There's stubs and everything. And I don't know whether that's what's done this to me.
So it's all swollen. Is it painful?
It's not that it's painful, it's just more awkward.
Okay.
You know, to try and open my mouth, and I just... I'm so upset. Is there any way I could go to a hospital and get these teeth out?
You can, but that your dentist would organise that.
I haven't actually registered with a dentist here.
You'll need to see it. You need to register with a dentist.
You see, I'm terrified of needles.
Don't worry, that's all right. We're here to try and help. It may be that we can give you some antibiotics. That's what we could do, really, to let it settle down while you're waiting
How long
to register.
will that take?
It probably is just a dental infection, and antibiotics will get on top of it quite quickly. Let's have a little look at this mouth, and I'll have a look in your ears. You open up for me. Yeah, it looks like there's something quite nasty going on at the top there.
Sorry.
All right. When I did look inside this lady's mouth, it wasn't a particularly pretty sight. It was pretty appalling. Some people just have a sort of almost a phobia. It's difficult sometimes getting people to access the treatment they need. You just have to take them through it, really. What we need to do is get you started on some good broad-spectrum antibiotics to get on top of that, but that's all that we can do, really.
You see, I'm so terrified of needles, that's why I don't go to a dentist. I know it's stupid.
If they want to do anything, we'd be happy to prescribe a little bit of sedation for you to have some procedures done.
I need to be knocked out because, I mean, they're in my gums, you know.
Yeah. OK, you're not allergic to penicillin?
Not that I know of now.
So this is a week's worth, 3 times a day. That should get on top of it quite quickly.
OK.
All right.
Listen, thank you
No
very much.
problem. It'll settle down with those antibiotics. It really should, but obviously it needs more than just antibiotics. All right, OK. All right,
Thank you very
no
much.
problem. Bye now.
Bye.
You not on any medication? Or why have you got to have a medication review then?
Hi, oh, gosh, hold on 1 minute. Sorry, I was reading.
Do you smoke?
I smoke a tiny bit.
And how much are you smoking at the moment? I'm a detective.
Yeah.
One day when I sort of put my hand out, I had a cigar there.
Yeah.
And I thought, I don't remember lighting that.
Is it all right to ask you some questions in front of your mum? Is that all right?
Probably.
Do you smoke?
No.
No, OK, all right.
I'm Dr. Mackenzie. We spoke on the phone last week.
Yes, we did.
Same problem?
I've restarted my antidepressants after a 6, 7, 8 odd week break.
What does it you take?
This is it here, if that means anything to you.
Yeah, and what dose do you take? One of these a day?
No, I'm taking 2 of those a day.
Right, OK. Does it work?
There's highs and lows. To cut a long story short, now I'm going to start. So, I need to get onto something that's going to give me my life back because I'm not. It's not happening. I'm not enjoying. I'm not living. I'm not anything.
Good morning, Fanny Mead. Rachel speaking.
We don't have anything for tonight, unfortunately. We've only got mid-morning by the look of it.
No, I don't have any today, sorry.
OK, just bear with me, I'll have a look at it. Unfortunately, no, not at the moment, I'm afraid.
So that's with Dr. Deman, 5 o'clock.
Come in. Hi there, hi. Come and have a seat. So Ellie, is that right?
Yeah. Ellie was going through really dizzy spells and just feeling absolutely ghastly. And we ended up at the Cromwell because she sort of did this dramatic collapse in the waiting room.
Right.
They ended up putting her in an MRI. But we ended up at an ENT specialist and he thought it was just really bad labyrinthitis.
Okay.
She couldn't move. And ever since then, we've had continuing episodes. Normally it's just sort of a day here and there, but this last week has been really awful. She feels so dreadful. She's just miserable.
Yeah. So do you want to just explain to me what it feels like when you...
It feels really dizzy and sometimes I feel sick and nauseous.
Have you been sick with it?
Yes. No, I haven't been sick. I just feel nauseous and really yuck.
And have you had any fever or sort of coldy type symptoms?
I get the often cough, but I don't think it's like a fever.
And is it generally, does movement generally make it worse? Yeah, so that's why lying down helps you to...
She just wants to lie and then we can't get her up.
Yeah, but then when I lie down, I can't really get up because I feel so dizzy. I can't move.
So I'm just going to take your temperature. And any headaches at all?
Yeah, I've had a couple of headaches, like really bad ones.
Do you want to describe the headache to me?
Sometimes it feels like somebody's like ringing, the church bells. It feels like I'm like right against one. And sometimes it feels like there's somebody hitting me and it really hurts.
Mm-hmm. And when you faint, do you actually sort of lose consciousness or do you just go to the floor?
When I fainted, I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted.
I'm just going to ask you to follow my finger with your eyes but keep your head still for me, okay? So, and just tell me if you see double, okay? Okay, that's fine. From what you're describing, it sounds absolutely like a sort of inner ear sort of disturbance. What we could try would be some regular Stemetil.
Does Stemetil help the dizziness or just the nausea?
Both.
Okay, all right.
Yeah. Then if things aren't settling or worsening, then I think it would be reasonable to seek the ENT's opinion.
Sure. Can I get a referral letter from Mrs.
That's fine.
Benjamin?
Yeah,
Is that all right?
That's fine, and I'll do that, and I'll leave that at the reception desk.
All right. Then.
Okay.
Thanks. Thank you. Have a good day.
Okay, and you. Bye, then. You're right.
When did it all start not to be right?
Many years ago. Many years ago.
5, 10, 15, 20?
It was triggered with children.
Yeah.
Triggered with the birth of the children.
So there was some postnatal depression?
Postnatal, definitely. I was obviously prone to it. It's depression in my family. We're clinically depressed. Like, this isn't just low times. We're talking, yeah, pretty bad. Yeah.
Dramatic things?
I think so.
Suicide attempts?
Not attempts, thoughts.
No. Thoughts, okay, fine.
Which is a step up.
So psychiatrists you've seen?
Yeah. I've just got this deep-seated depression. I just don't know how to get out of it. I really don't. Mm-hmm. And, the kids are suffering with my moods, my this, my anger, my aggression, my everything. So it's not a very nice spot to be in.
Okay, so I think
very difficult.
The situation at the moment is certainly not to rock the boat. I think we certainly don't want you to run out of your medicines. You've had 6 weeks off.
Yeah.
And that doesn't seem to have helped. So we'll give you a prescription for another month of that, and then we need to talk again. So there's enough there for 4 weeks, 2 a day, so that's the 40 milligram. So if we can meet in about 4 weeks' time. The children, boys or girls?
One of each.
Right. I want to see you before those tablets run out, so about 3 to 4 weeks up the road.
Yep.
And you can come back sooner if things were different or worse.
Okay.
Okay. Bye for now.
Bye.
It's NHS, they're up to their eyeballs with appointments for sick people.
I'm going to be doing some very basic stuff: height, weight, blood pressure. You're a gentleman who has quite a few health conditions.
Yeah.
Yeah.
But I feel perfectly fine.
Which is brilliant, and
Thank you
we want to keep you that way.
Yeah.
So to give you a little bit extra time with a doctor to make sure that I'm just looking at your face and you're not saying ugh, but it's to make sure.
No, well, I've got a problem straight away with that.
What's that?
This. In September, I asked for a book.
Right.
She went to her cupboard. No, I haven't got one. So she wanted to give me the other book,
Right.
which I can't get on with.
Right.
Now, that lady could not walk next door to get one. So this is my problem when you're talking like this.
Right.
You imagine if I've been seriously ill or someone had been seriously ill and she couldn't be bothered to go next door. Yeah. She shouldn't be in the job, personally. Right. Nothing against yourself, but when you're going on about all this, and I've had an experience of that,
yeah.
I don't think it's very funny, like, personally.
No.
Sometimes you feel like you sort of, well, does anyone really care anymore?
Right.
Hi, Mr. Walker. Come in.
You are a very lucky man.
Why is that?
Just about ready to go.
Were you?
Thanks. I've been waiting here over an hour.
Yeah, I'm really sorry. I've just been...
No good, it's not good. Very annoying. Carry on.
This has been going on since last December, and I've had enough.
But how long is it going to be? You know, I'm going to be dead by the time I see them.
Yeah, okay.
The service has gone downhill, personally. That's how I've felt.
Yeah. Yeah.
And the only other thing I've got to think of, I'm not happy with the book.
Come in. Hi there, hi. Lost your voice. Have a seat. I'm Dr. Rose, by the way, I don't think we've met.
No, I don't think we have. So I don't know whether you've had a quick look, but it's an ongoing condition.
Okay.
So I've had 7 operations over the last 7-8 years. I've got another one due in 4 weeks. But it never usually gets as bad as this before an operation.
Do you want to just explain to me the history?
Yeah, so it's the HPV virus on the vocal cords. The first time it happened, they cut them away, analysed them, it's all fine. And it was quite a while before they came back. And then this year, I've had 3 operations.
Right.
So it's quite aggressive at the moment.
Yeah. And other than the sort of loss of voice, do you get other symptoms with it? Is it uncomfortable or?
It is at the moment because I'm having to push words out, I think.
Yeah, so it's
because when I try to talk, there's nothing coming out at all. And it's
quite exhausting.
It is.
Yeah.
And I'm having a few issues with work because I work for a university doing inquiries and I can't answer the inquiries.
You can't answer the inquiries at the moment.
No, it's just getting quite impossible, really, to carry out my job. Really, I'm just asking whether it would be possible to be signed off until the operation.
We'll just have a look and see. Do you want to open your mouth up nice and wide for me? And say, oh, for me. It's not in the area that you can see, it's further down onto your vocal cords, so you can't actually see anything there. Okay, and no fever or cold or cough or anything like that? No. Okay. I mean, it doesn't seem that there's much choice really if they can't bring the operation forward and work can't find anything else for you to do. It doesn't seem that it's fair for you to continue working. So I've signed you off till the Monday following the operation on the Wednesday. Hope it goes all right.
Thanks. You'll be used to it by now.
How long have you been on the HRT for now?
2 years.
Okay.
Yeah, 2 years.
And what symptoms did you have before you went on it? What was the reason?
Well, I went to my gynae, who I
Right.
see every year. He's known me since he produced my last child, who's 23 years ago.
Okay, all right.
And his expression was that I'd hit the buffers in my life.
Okay.
And he said, I've got some magic potion for you.
Right, okay.
And this was it, and then indeed it has been magic.
Okay.
You know, he put me on this and I haven't looked back.
Are you having any periods at all?
No.
No. And
Thank
so.
God. Those days are over.
Oh, right. And what did he explain in terms of the risks and benefits of?
Lots. Explained everything. I do have mammograms.
And they've been normal.
They've been normal.
Can I do your blood pressure? May I do that?
Oh, crikey. Yes, I'm just about to play tennis and
Right.
all sorts of things. And...
When you're on HRT, we need to keep a close eye on your blood pressure as well.
Do you? Oh, OK. I didn't realise.
So, nice slow breaths, and then we'll... Okay. It's not very high, but it's certainly not kind of in the low in your boots.
All right, okay.
But I think given that you're on HRT
Yes,
and we need to keep an eye on it.
yes,
I guess the question then to ask is how long do you foresee taking this for?
I'm not a drug taker. No. Do you know what I mean? I don't pop pills unnecessarily. So, I mean, it's just, I know it's there. It's my little crutch.
It's your crutch.
Yeah.
Okay. Well, can I suggest if I can give you 3 months this time round, and then we could have a follow-up discussion about that, so making a plan.
Okay.
Is that okay?
Yeah, perfect. I've got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
Well, nice to meet you.
And you.
And we'll touch base, as I said, in about a month's time.
Oh, yeah, all right.
Have a nice day.
To meet you.
All right,
Bye.
bye-bye now.
Oh, a pink sticker. Have you had a flu jab? Very good.
And how are you feeling since all the events with all the bleeding?
I'm very lucky to be alive. What happened is I was driving
to
play golf, and I from York to Chester.
Yes.
And I decided to fill up with petrol at the last petrol station just outside Chester. I know it very well. And I got out of the car. I filled the car up with petrol, and I felt a bit giddy. And I thought, oh, fumes from the. Went in to pay the bill, and that was the last I remember. Next thing, I was in an ambulance being rushed to the Countess of Chester Hospital.
This happened in the morning, and by the time we got there, which was about 5:30 in the evening, he was drifting away, he was fading away.
Goodness.
And he was still bleeding, purging blood, and they were pumping blood into him. And we were told by one of the doctors that some people stop bleeding and some people don't.
Put 6 pints in.
6 pints of blood.
6 pints.
His temperature had dropped to 60-something over 20-something. And he was drifting away, so I held his hand and I told him to keep awake, stay awake, stay awake.
And had you had any symptoms before any of this?
None at all.
So no pains?
No pain or anything.
Nothing like that?
Quite extraordinary.
Well, it is. I don't know, you've been very lucky, I think.
Have I?
Yes, because I think it sounds like it was a very scary episode up in
It was
Chester.
terrible, terrible. We almost lost him.
I wake up in the night because I just can't get any air into my lungs.
So big deep breath in, and then blast your air into there. 1, 2, 3, and keep blowing, keep blowing, keep blowing. Keep blowing, keep blowing, keep blowing. Stop when you need to. Well done.
With hindsight, it's easy.
Yes.
The only indication I had that there was something wrong is that morning before leaving Yorkshire, I had to sit on the loo, and I thought I had diarrhoea because I was on the loo for a very, very long time, and without being too vulgar, I virtually filled the loo. And I thought, this is diarrhea. I didn't realise it was black blood.
Was it black?
He didn't tell. He didn't.
But I didn't, I didn't think about it.
No. Shall I have a look at this wound?
Yes. Sorry.
That's all right.
The nurse is coming to take the rest of the staples out tomorrow morning. She's a fantastic nurse.
So they took out the whole of the tumour?
The whole of the tumour.
It's all out?
They had to take the spleen out as well.
Yeah, they took out the surrounding tissue.
That's right. I don't want to take this off because I think it's well dressed, but I can see around there it looks still a bit moist, but this end is healing nicely.
I'm on penicillin
now
for the rest of my life.
So it's going to be lifelong, yes. Once it's all settled, there's no reason you can't carry on doing things as normal.
Right.
I think you just have to have a period where you're just convalescing.
The other thing we don't know, we haven't had the result of the biopsy on the tumour as to whether it was, benign or,
How are you feeling about it all?
Fine.
Are you?
Determined to get back fit, look after my wife. She's a very good nurse,
yes, she is.
but I need to look after her.
Yes.
So.
Right, good. I would suggest we touch base once you've seen the Marsden. Okay.
How can I help today?
I came from France and I forgot my drugs.
So are you just visiting here?
Yeah, I'm just visiting. I'm a sort of temporary patient, and I forgot those 3 drugs. There's a statin and the aspirin, and then there's a blood thinner, but I don't know which is which.
Okay. Can we check your blood pressure now that I've got you in here? Are you just over here seeing family?
No, I had to get a new passport. My wife just died, and so I need to get back to America. She was American, and uterine cancer. Yeah, and so it's sorting out affairs and doing stuff. And I come over for a sort of a health check, but I'm sorry, this is unscheduled, you know.
Now, while we're doing that, let's do this again. Be nice and quiet for a moment just while we check this.
Oh, okay. Is it high?
It's probably because we're talking, so...
I had it checked about 2 weeks ago.
Now we're talking again and it's gone up, so nice and quiet. Sit back in the chair and no chattering.
All right.
So your blood pressure's 146/94, which is a bit higher than I'd like it. So just when you get back to France, get it checked again.
Oh, okay.
But let's give you these medications. So aspirin, tenolol, and then there is suvastatin, one to be taken at night. Okay, it actually says on here, le soir.
Le soir, yes, it does. That's your actual French.
I remember something from my GCSE days.
Yeah, well,
All right.
I didn't even look at that.
And don't take it with grapefruit. That's another one. Don't ever have grapefruit with your statin. It increases the risk of you having side effects like muscle aches and pains and inflammation of the muscles.
I have a grapefruit every day.
Oh, I probably would avoid
in the morning.
it.
I don't sort of have a spoon or cut it. I eat it like an animal over the sink, so very quickly before I have my porridge and fruit and stuff.
Not having grapefruit.
Oh, really?
Yeah.
It's bad for the condition, is it?
Bad for the statins because it increases the risk of getting inflammation of the muscles.
So that's a statin, is it?
Yeah, that one's
Well, I
the
take it. I
statin.
have a grapefruit in the morning, so the statin at night would be okay, would it?
I mean, the recommendations are that you don't have grapefruits.
All right, well, I'll take that on board. Thank you.
Okay.
That's great. You've been great. Thank you very much.
No problem.
Thank you.
Don't forget your wallet.
Bye.
I'm going to take it as a tip.
Thank you. Bye.
See you later.
Is it itchy?
No.
Is it very tender to touch?
Yes.
Can you just twist the top half of your body and just go right round and then the other way?
So you come for your blood test, for your blood sugars. Just relax the hand.
Hello there. Nice to see you. Have a seat. Now, we've called you in for a global health assessment, I think, is something...
Well, yeah, I had to have a blood test.
Well, your blood pressure is certainly perfect. Your cholesterol is brilliant, so the tablets there are working very well. Kidney function's a little bit reduced from normal, but it's very stable. How have you been feeling in yourself?
Not all that, to be quite honest with you.
Mm.
Not all that. My legs play me up.
Mm.
And I do get a pain in the right-hand side here.
Yeah, that's to do with that arterial disease that we know you have. Do you mind if we just check your hips and legs out, if you pop in behind the curtain there for me? Just lie up on the couch and tell me about the dreaded cigarettes.
To be quite honest with you, I started again.
Right, well, that's a little bit of a problem. We know the circulation in your legs is not great. There's a bit of a pulsation here, and certainly none further down. I'm just going to rotate your hip a little bit. Just tell me if it's painful. Okay, well, they're both a little bit stiff, but the problem is still that circulation in your feet. Up you come. I think there's a good reason for asking a blood vessel specialist to have a look at you. I'll arrange a referral up at Queen Mary's, and we'll get that done fairly quickly. Date of birth is 1st of May, 32.
That's it, yeah. 82 years of age.
So during the last month, do you feel down or hopeless, depressed?
Yeah.
Frustrated?
Yeah. Yeah.
How big a problem does that get?
I just have to get on with it, don't I? You know, I used to go to my daughter's in Sussex, but I don't go now. But she phones me regularly.
Right. Does she come up here at all to see you?
Oh, yeah, but not like she used to.
No.
And I used to go down there quite a lot, but I feel I don't want to go now.
Yeah. And friends? Do you have any friends left of your age around?
No, not really, no. A few of the neighbours I get on with.
Yeah.
But other than that, no. Don't have no friends.
It strikes me that your legs are a big part of interfering with your life and making you a bit depressed, really. Mm-hmm. And if we get Queen Mary's to do an assessment, and I think that if we can make your legs better, I think it'll make a big difference to you.
Yeah.
Hi, all right. Come
Yeah,
in, have
good,
a seat.
thanks.
Is it Wesley Stone?
Yeah.
Hi.
I'm going to South Africa for 3 weeks for holiday.
Yeah.
Yeah, so I just wanted to get a prescription for my paroxetine and Lamictal.
So you take it for the bipolar, is that right?
Yeah, well, I was diagnosed with bipolar when I was, 16 or 17, but I was taking a lot of drugs at the time. So, I mean, I've been clean now for four years.
That's
no,
great.
longer, 5 years.
Yeah.
I gave up drinking 2 years ago, so I don't even drink. I used to get very aggressive for no reason before,
Yeah.
Sometimes if I would feel a bit depressed, I would go and start punching up a wall, and then my knuckles would be all smashed for a couple of weeks. And so instead of cutting my wrists, I would do that rather,
But we're not,
Yeah, but that's...
Things are a lot better, aren't
Yeah,
they?
that doesn't even happen,
Okay.
So.
At the moment, are you feeling suicidal or like hurting yourself?
No.
No. Okay, well that's good. And it sounds like you've taken away a lot of the factors that were causing your mood swings, and that as a result of that, it's become quite stable. Is that fair to say?
There's absolutely nothing wrong with him now. He never gets angry. He probably doesn't even need the tablets anymore because he's perfectly fine.
So we're in a better place, aren't you?
Yeah.
Have you ever seen a psychiatrist in England?
No, because I haven't really felt I needed to,
Yeah.
And that's the whole reason I changed my lifestyle over the last 5-6 years,
Yeah, and you've done a great job with that.
Yeah.
From what you're telling me.
Yeah.
So shall I give you the medications as you normally take them?
Yeah.
And maybe you can come back and see me after South Africa.
Yeah, that will be
and
good.
And we can make a proper go at reducing these medications. Getting the psychiatrist involved when we need to. Does that sound all right to you?
Yeah, that would be good. Yeah.
See when we've got some appointments available when you come back, and we'll take it from there.
And then, yeah.
All right.
So I'll see you then. Eh?
Yeah. All right. Take care. See you later.
Bye.
All right. Bye now. Bye.
Good morning, Putney Mead Care speaking. How can I help you? Okay, hello?
There is. No, you're right.
She hanged up the phone.
Hi there. Hi. Mrs. and Miss Doyle. It's Miss Doyle we've come to see today.
That's right.
Right, this arm. Presumably.
Yes.
Still hasn't really gone down, but it's getting better.
I think it is getting better, isn't it?
The only reason we're
But
back...
it's very slow.
Yes, and it still feels quite hard underneath.
Yeah. Maybe that's 18 millimetres by 18 and a half. I said 20 by 20 last time, so I think this is settling down.
Do you?
It takes a long time, but it is a frustratingly long
Well, I'm
period of
happy
time.
if it's going. We're happy if it's
Yeah.
going.
Yeah.
I think she's had so many antibiotics. Don't really want her to have another course because she's had so many in the last.
Well, for this, I've had it for my ear.
has come back with her mother, full stop. The area of inflammation is reducing. It now measures 18 by 18 millimetres, full stop. There is no fluctuance, so nothing to cut into, full stop. They are to return in 2 months if it has not fully resolved, full stop.
Because she's getting quite a few skin things, do you think some children are just predisposed to, because that's, you've got molluscums and...
I think her immune system's trying to keep it under control.
Good.
But lots of people need a little bit of help.
So we just paint the stuff on, do we, and then it zaps it?
Cross fingers, yes.
Touch wood.
Touch wood, yeah, absolutely. That is the instruction. Okay.
Thank you, and thanks for seeing us today. Thanks very much. Thank you.
Bye.
Bye for now.
There's no hurry. Oh. There you go. Come and have a seat.
Thank you.
Oh. You're doing a bit of falling around the place. You've had about 4 falls by the sound of it.
And in fact, last weekend, I had to take her to the emergency, Princess Grace, because her ankle was all swollen and her leg was bright red. So I rushed her up to the Princess Grace and they'd given her a course of antibiotics because it got infected.
And is it better?
It's getting better. We've been coming here to have the dressing changed.
Yeah.
I had blackouts.
Yes.
But
And
the
they're
last
very
one wasn't a
painful.
blackout. I think she just lost her balance.
Yeah.
I've actually watched her and she sort of loses, does that, and I think it's
Okay.
just a question of not having balance and
You
strength.
may be absolutely right.
Strength in
But
her.
it's funny that she sort of blacked out. Is that...
Well,
It doesn't tell me I'm going to black out. It just blacks out without.
I know. So maybe going to the Falls Clinic
Yes.
might actually be a sensible move.
I haven't got much longer, have I?
You've got a lot longer.
Well, the thing is, you can't depart
No.
from this earth by appointment.
No, that is
You have to do it.
absolutely true.
You have to do it when your
Yes.
cards are up.
That's right.
So what we want to do is try and stop you falling over a bit so that you don't break anything.
If you
I
could
mean, that
tell
would be
me.
that would be the worst thing you could do to break something and find
Yes.
yourself in hospital.
Yes.
She's got a care team starting next week who are coming twice a day and are going to take her out for walks and
Good.
give her a bit more confidence.
And that's helpful to you.
Very, very helpful because I'm completely exhausted. Her mind is getting quite bad.
Yeah.
Her confusion is very bad. Isn't it, Mummy? You get very confused.
But I'm very old. I'm 91. I mean, what else can I?
You remember
Well, this is why your daughter's organised for people to come in and keep an eye on you, and
Yes,
Yeah.
which I think is very sensible. You know, your daughter's
well, I
your
never
daughter's
had to.
coming over, and she needs a bit of help. Otherwise, if she gets overtired,
Yes,
then
of course.
then it's not going to help.
I'm not
her.
a young woman anymore, unfortunately.
No, you think she's still a spring chicken, but
She's
she's
40 something.
No,
That's a young.
No, I'm 65,
Oh,
Mummy.
really?
Yes.
That's the problem, is that we're all getting a bit older.
What can I do for you
It's
today?
only a stupid thing. My toes got infected.
So that's an infected and growing toenail,
Oh,
I
is it?
think.
Can we keep the toe?
You can keep the toe.
And about 10 days ago, I had athlete's foot. Now I'm faced with intense burning and intense irritation.
It's hot. My feet are hot.
So it's like burning like fire.
Mainly under my toes.
You've got quite a lot of breaks in the skin. This may be a little bit of residual infection. That's a little verruca. Don't worry. Does it hurt you? No. This swelling you were pointing out?
Round there.
Yeah.
There.
Okay, okay. So
Oh, I'm sorry, I've given you the wrong foot.
Hello.
Peter, hello there. Have a seat. Just trying to see when I saw you last. I think it was about 10 years ago. We've spoken on the phone since then, but obviously something fairly dramatic's happened. When did they formally tell you that it was lung cancer?
About a month ago.
I think you'd had a scan that was pretty suspicious.
I've had a scan, I've had biopsy.
Right.
It's a lot. I got fed up with it.
Right.
Really fed up with it.
Yeah.
Well, like chemotherapy, I didn't want to go through it. I refused it because I think they turn you into a zombie.
Obviously, without treatment or intervention, it's going to get worse.
Yeah.
The specialists wouldn't impose treatment on you that they thought had no chance of helping in some way.
I haven't heard of anybody having chemotherapy and all the rest of that survived. They all died.
Mm-hmm.
And even if they operate, there's no guarantee either.
No, no one can. If people promised you that it would be okay, they'd be lying. So
I won't believe them.
Who's the consultant that you've been under?
Dr. Poppet.
So have you seen Dr. Poppet?
No.
No. Is there an appointment?
On Monday.
I can't see any use of seeing him.
It would help me a lot.
Would it?
Yeah.
Oh, well,
Because it's got to be a balance of the benefits against the negative effects. You know, if those side effects were short term, but we're going to give you another 3 years.
The side effects can make you vomit, lose your hair, diarrhea, and many other things.
Yeah.
I mean, I don't want to go through all that.
Well, you know, I can't make that decision for you, but I think that you shouldn't make that decision without having the input of a cancer specialist. You know, you're sticking your head in the sand a bit. The most challenging patients in general practice, I think, and those that generate the most emotion are situations where you can't make much difference to their outcome. By and large, though, the overwhelming emotion seen is of strength and courage. You've got the power, not me and not him. You know, it's your decision at the end of the day. But I think that we shouldn't make it without all of the right information.
If that's all it is, okay, I'll go and see him.
The pain, you don't need any painkillers?
All I use is Anadin.
You got, right. A lot of prescribable medicines, but I think we'll wait and see what Monday brings. Okay.
Thank you.
Peter,
Yeah.
So it's been a long time, but I think we'll be seeing each other fairly frequently.
Are all doctors healthy as well?
No.
Thanks
Okay.
a lot, Doctor.
Yeah. Okay. Thanks. Bye.
Hope you're feeling better soon.
Thank you.
Okay. Cheers now. Bye-bye.
Well, good luck with your Spider-Manning, all right? You're going to sort all the baddies out. See you later.
Thank you very much.
Bye.
See you again.
Thank you very
Cheerio.
much. Bye-bye.